There is no more scary situation than when someone learns that they might lose vision, your most precious gift. Macular degeneration is the #1 cause of vision loss to those that are 65 and older. It's what made me go into medicine. My own grandmother, Belle Moore, had macular degeneration, and I can't tell you what it was like when she couldn't see my face and couldn't read. And I went all over for second opinions, and they all told me nothing could be done, until finally, where I eventually trained at Harvard, they said something could be done, and they were right, and she could see. Moore Eye Institute is going to spare no expense with our partner hospitals to bring the finest diagnostic equipment anywhere. 2 of the 3 most important tests for macular degeneration were introduced in Pennsylvania here at Moore. We have, and I mean this, the finest visual rehabilitation center in the world. I invite you to watch our extensive educational video. You will understand your condition, you will understand the options, and you will feel good, because let me tell you, the greatest fear is that fear of the unknown, and we've got to be partners, and that's what that video is about. Come join us. We're there to help you.
Hello, I'm Dr. Geeta Ravat. I'm one of the retina specialists here at Moore. It's my pleasure to serve as moderator for this video. Dr. Ginsberg, our chairman, has given you an overview. Our goal is that after watching this video, you will fully understand macular degeneration and ways to preserve your vision. Vision is such an essential part of our lives. So much of what we do and enjoy depends upon the ability to see clearly. So if your vision begins to fail, it can cause great anxiety. But if you understand what's happening with your vision, you gain a sense of control over the situation, providing some peace of mind. One of the leading causes of vision loss in people over 65 is a condition called age-related macular degeneration, also known as AMD. To understand how AMD affects your vision, it is important to understand how the eye works.
Light rays enter the eye through the cornea, pupil, and lens. These light rays are focused on the retina, a light-sensitive tissue lining the back of the eye. The retina has 2 areas, the peripheral retina and the macula. The macula is a small area at the center of the retina. The peripheral retina is the large area surrounding the macula. It is the peripheral retina that gives us our side or wide-angle vision. It is the macula that gives us our pinpoint vision and allows us to see details clearly, helping us to do things like drive, read, or recognize a face. Age-related macular degeneration, or AMD, is a breakdown of the macula. When the macula doesn't work properly, your central vision can be affected by blurriness, dark areas, or distortion. This condition affects many people as they get older.
There are 2 forms of AMD. One is called atrophic, or dry form, and the other is called exudative, or the wet form. About 90% of patients that get AMD have the dry form.
The retina is made up of many layers that are sandwiched together into a smooth surface. These layers work together, allowing us to see clearly. In people with dry AMD, the layer under the retina, known as the retinal pigment epithelium, or RPE, is affected by deposits, called drusen, as well as other age-related changes. These changes may cause vision to deteriorate.
Many people do not realize they have macular degeneration until they notice a problem with their vision, or until AMD is detected during a regular eye exam.
I was just going to my eye doctor because it's something I do every 2 years. Again, to see if I need a little stronger prescription. And what's interesting is that my prescription hadn't changed at all in 6 years. It's pretty much the same prescription. So when she told me 2 years ago that she wanted to send me to a specialist, that I was a little surprised because I didn't have any idea why.
Many people develop dry AMD as they age, and in many cases, it is very mild. However, the disease can progress to more advanced stages. People at high risk for developing later stage or wet macular degeneration are those with intermediate AMD in both eyes or advanced AMD in one eye. Scientific research shows that among those people at risk for advanced AMD, taking dietary supplements of vitamin C, vitamin E, beta-carotene, along with the mineral zinc and copper, lowers the risk of developing more advanced AMD by about 25 to 30%. There are many kinds of vitamins, and we can hand out to you a description. Please ask us, Smoking can make macular degeneration worse. Also, if you smoke, there are significant risks with taking some vitamins, so be certain to tell us if you smoke. You should also discuss with your family doctor the vitamins you are taking.
Well, when I saw my ophthalmologist the very first time, he recommended that I take a vitamin. You know, if this is going to help either slow down the process or improve the situation with my dry AMD. I was willing to try it, obviously. I mean, I had everything to gain and nothing to lose, and I've been taking the vitamins now for a little over a year.
One of the doctors here at Moore Eye Institute will tell you if you are at risk of developing advanced AMD, and if supplements are recommended for you. At any stage of AMD, we encourage you to closely monitor your vision every day for any signs of changes. A basic yet important tool for monitoring your vision is called an Amsler grid. You can use it at home to detect changes in your central or macular field of vision. You will simply sit in a well-lit area and hold the grid away from you in a comfortable position. If you wear glasses, you should keep them on. Cover one eye and look directly at the point in the center of the grid, but observe the pattern of vertical and horizontal lines in your peripheral vision. Then do the same with the other eye. Typically, a visual abnormality due to AMD would cause some of the straight lines to appear wavy or blurry, or areas to appear dark or even blank. If you notice any new changes in the grid, you should contact us immediately. If a person with dry AMD notices changes when they use the Amsler grid, this can be a sign that wet AMD is developing. Detecting wet AMD as early as possible is critical for seeking treatment and minimizing visual loss.
With wet AMD, abnormal blood vessels begin to grow under the retinal layers behind the macula. These blood vessels leak fluid or bleed, which further blurs or distorts central vision. About 10% of people with macular degeneration have the wet form.
One of the most important factors in treating wet macular degeneration is early detection, although it may be impossible for us to predict if you will get wet AMD. Using the Amsler grid on a regular basis can help to detect vision changes as early as possible. If we suspect macular degeneration, diagnostic techniques such as optical coherence tomography, or OCT, can be used to help identify what is going on with the macula. With OCT, a special camera is used to take a picture of a cross-section of your retina. It measures the thickness of the retina and is also very sensitive to detecting fluid and blood vessels under the retina. This diagnostic information helps us determine why your vision is blurred and whether treatment should be started or continued. We here at Moore Eye Institute introduced the first OCT in Pennsylvania, one of the most important developments for managing conditions like macular degeneration and diabetic eye disease. Another diagnostic test we may use is fluorescein angiography. Fluorescein dye is injected into a vein in your arm, and the dye travels to the blood vessels in the eye. A special camera is used to photograph the retina and blood vessels, which are illuminated with dye. These images provide a map of problem areas and help us identify appropriate treatment options and monitor their effectiveness. The third diagnostic test is indocyanine green angiography, or ICG. It's similarly performed as fluorescein, and sometimes we do the test at the same time. That way, only one injection instead of two is required. ICG allows better visualization of the choroid, where the new blood vessels come from. I am honored to work with Dr. Ginsberg, who was one of the first in the world to introduce digital ICG, which allows doctors to identify polyploidal choroidal neovascular membranes and helps precisely identify the full extent of wet AMD. Both fluorescein angiography and ICG are usually very well tolerated. Some people can get nauseous, and some people can be allergic to the dye and have a life-threatening reaction, but that is extraordinarily rare. For people with wet macular degeneration, there are treatments available. While they are not cures, these treatments can help stop the progression of blood vessels, which, if left unchecked, could lead to significant loss of central vision. If fluorescein angiography, or ICG, shows us the abnormal blood vessels are not directly under the central macula, it may be possible to treat them with standard hot laser therapy.
With laser therapy for wet AMD, the pupil is dilated using drops, and an anesthetic is given to numb the surface of the eye and, in some cases, to keep the eye from moving. A special contact lens is placed on the surface of the eye to help the surgeon see the retina. A high-energy laser beam is aimed at the tiny leaking blood vessels to seal them and to help stop them from growing. It is important to stop the spread of these vessels as quickly as possible, but depending on how close they are to the center of the macula, the patient may experience some further permanent blurring or loss of vision after the procedure. Of the patients with wet AMD who have the standard laser procedure, it is likely that 50% of them will need a retreatment within 3 to 5 years.
Another form of treatment for wet AMD targets a specific chemical in your eye. This chemical, called vascular endothelial growth factor, or VEGF, is critical in causing abnormal blood vessels to grow under the retina. Several new drugs have been developed that can block the trouble causing VEGF. An anti-VEGF drug can help reduce the growth of abnormal blood vessels and slow their leakage, which helps to slow vision loss and in some cases may even improve vision.
The anti-VEGF drug is administered directly into the eye in an outpatient procedure. After the eye has been numbed with an anesthetic, the anti-VEGF drug is injected into the eye with a very fine needle.
So I've had injections probably 3 times. And you would think someone putting your needle in your eye would be really, really painful. It's not. The thought of a needle going in your eye is worse than the actual procedure. And I believe that they were very helpful for me.
In some cases, anti-VEGF treatment may be combined with other therapies, such as the laser previously described. Also, there is a cold laser that we may occasionally suggest for some people called photodynamic therapy, or PDT. We here at Moore Eye Institute were the first to own the PDT laser after the FDA approved it in Pennsylvania.
The photosensitive drug is injected into the patient through an intravenous infusion and travels to the abnormal vessels behind the central macula. The drug attaches to molecules that are commonly found in rapidly growing cells, such as those in wet AMD blood vessels. A low-powered laser light is focused directly on the abnormal vessels, which activates the drug, causing damage specifically to the unwanted blood vessels. Usually multiple treatments are required.
It is important to remember that only about 10% of all AMD cases are the exudative or wet form. Some of these wet cases may not be treatable or may not respond to treatment. But people with untreatable AMD won't become blind. They will still have peripheral or side vision. Our low vision specialists are world-renowned and often they can help. In fact, the doctors at Moore Eye have designed more individualized optical devices than anyone in the world. They work in conjunction with your optometrists.
This is what we have at Moore. A team approach where multi-specialists work with your family doctors and most importantly work with the family and work with you, whether it's to take vitamins or to use an ampular grid, and then treat you, whether it's intravitreal injections and lasers or photodynamic treatment. There's so many different options. There is always something that can be done. We as a team, with you, hospitals, the best diagnostic equipment, and a caring heart, we are going to do what it takes to preserve your vision. We are going to do whatever it takes to help you.